Hey guys, it's me, Mr. 250, and welcome back to Trauma Team. We're gonna come back and because we've been working on these forensics missions for the past 2 episodes or so, and I wanna start proceeding with the game. And I was told, I said this before, but I was told we need to start going vertically down these lines. We should probably start with Gabe, is my thought, just because Gabe is sort of the intro to most of these operations, because he diagnoses them.
Yeah,
so I figure we'll do a couple of Gabes.
I called in a special surgeon.
I see. And the cause of it all? Could it be an epidemic?
I can't say. Like you, I'm getting a bad feeling here.
We need to look into this as soon as possible, then.
Yeah, you're right.
Gabe? You sound tired. Did something else happen?
Oh, Gabe, please let us learn about your backstory.
I've just been fed up with myself lately.
What's wrong? You don't seem like your usual self.
Yeah, don't worry about it. Anyways, try and get over here as soon as possible.
Well, alright.
Simplest truth.
Gabe, you there?
Of course I am. Some of us can't loaf around on the job.
How sweet. I'm gonna let that one slide. Your patient's being discharged today, but she wants to see you.
The lady with Kaposi's? I wasn't the one who saved her. If she wants to talk to someone, call her surgeon.
Oh, hell no! That guy is a serious asshole.
Whatever. I don't plan on going down there either. Anything else?
Yeah. There's one more thing. We're understaffed and the chief wants you to take this one.
Is that all? Well, give it here. But the patient's... Joshua?
Well, if you don't want to, I can ask another doctor.
What kind of doctor would I be if I chose my patients?
It was very reassuring the way you sort of laughed to
Roni,
yourself.
Let's start the diagnosis. Bring it.
Yes, Doctor. The patient's name is Joshua Cunningham. He is related to you by blood, Doctor.
Is there a problem?
Negative, but I can request a new doctor if you prefer.
I'll be fine. Man, he really programmed you well.
I must take into account the feelings of those around me. Observing colleagues allows me to gather their emotional data.
Yeah, you're perfect. Now you just need to learn how to talk.
I have a feeling that this isn't just gonna be a cut and dry thing. It's probably gonna get really dramatic and stuff here. Dad! You're just a patient to me, kid. Something, I don't know.
Oh, hello. You're a new doctor.
Oh, he doesn't recognize his dad?
Yeah. Hello, Joshua.
Or does he?
Doctor, I don't hurt at all.
I don't know if he does.
That can't be. I received a report from your nurse.
That's weird. I'm all right, really.
Well, let's check you out. If I can't find anything, I'll let you go back to your room.
Okay. I'm sorry, Doctor.
No, it can't be
Roni,
that
I'm
easy,
beginning
I'm
the
sure.
diagnosis. Are you ready?
Yes, Doctor. You may proceed.
I bet he's probably got liver failure. Something else equally dangerous.
Huh? I feel fine.
You feel fine, but are you fine?
I clean my plate, and I don't hurt at all. I'm just here because the nurse said I had to be examined. But I feel just fine.
Yeah, but why would the nurse say you need to be
Maybe
examined?
She mistook me for some other kid? Oh, but don't blame her. She's real nice. She's always worried about me and does a lot. I wonder, did something bad. She was really worried about me.
Can't really pull anything from that as far as I can
That's
tell.
odd. He really does seem to be fine.
See, most of the people that have a problem, they'll be like, I don't have a problem, and later they'll be like, oh, my stomach feels like it's gonna explode, but yeah, I'm okay.
Huh? Yeah, I mean, there's nothing wrong with me.
Exploding stomach, write that down, Roni.
Well, all right. But just to be safe, let's finish examining you.
It's probably gonna be, yeah, we're probably gonna have to use a tool to figure it out. Because if he actually feels fine, there's nothing we're gonna get from just questioning. Let's take a listen. Fairly certain that's right. Yeah. And that's right. Yep. And heartbeat. Yep, that all sounds good. What's wrong with your face? He really does have my eyes, doesn't he? Is that an abnormality? I don't think so. There's nothing weird here. I don't think any son of mine would be this pale. Yeah, he seems okay. Should be wearing some slippers, that's abnormal. Alright, EKG, what you got? And I'm fairly certain that's normal. Yeah, it all looks normal. Everything looks normal.
What in the heck? He doesn't have a single symptom I can find.
Oh, coughing, quick, Roni, write that down.
Oh, I'm sorry. It's just a cough.
Huh? That looked rather strenuous. But it's just a cough? Roni, patient's hiding something.
Uh-oh,
I'm
Roni.
continuing the exam.
We're gonna have to beat it out of him.
Understood. Proceeding with the diagnosis examination.
Roni, you're gonna have to get me the big stick this time. Big stick. Do we have to go back and question, or... do we have to get, like, images? No images? We have to continue. Is it maybe we need to re-listen with the stethoscope now? Well, his breathing's fast, at the very least.
The boy's breathing pretty rapidly.
Oh, he's nervous.
Roni, make a note of it.
Understood, Doctor. New symptom observed.
Guess it does happen when you start hitting people with a stick, doesn't it? Tachypnea, got it. Same thing. And that's a fast heartbeat.
His heart rate's increased. Is this a symptom? Roni, record this. I think this is a definite sign.
He's nervous.
Understood, Doctor. New symptom observed. Increased heart rate.
It seems
What have
that
you-
earlier
what have you been
attack
not
is causing
telling us,
symptoms
kid?
to appear.
You dang lying kid.
There it is again. There's no mistake about it. Hey, show me the hand you covered your mouth with, right now.
Huh? It's nothing. Come on.
Oh, is he coughing
Jeez,
blood?
This kid's gonna try and hide as much as he can from me, huh? I need to see what's on his hand. I need to get him to use his hands.
Oh boy.
What can I do?
Do we get to be creative again and try to figure out how to see his hands? It's not an abnormality in that itself. Do we have to re-question him, I would imagine?
Don't tell me. You think I'm sick too, don't you?
That's because you won't tell us anything, kid.
Look, I'm okay. There's nothing wrong with me.
try EKG again. That all looks okay. Okay, that all looks fine. What can we do? Like, that's what that was said. What can we do to get him to show us his hands? There's nothing weird with his stomach. We already questioned him. We already checked with the stethoscope. Was there anything weird with... Oh, wait, hold on. Hold on, I think I just saw something. Yeah, there. What's this? That's abnormal.
Yep, there's blood on his clothes. He still had blood on his hand when he lifted his clothes up. The boy coughed up blood a moment ago, and he tried to hide it. Roni, make a note that the patient has hematemesis.
Coughing up blood is bad,
Understood.
from what I know.
New symptom observed. Hematemesis.
Hematemesis. Dang kid hiding your hematemesis.
Hey, kid, why are you trying to hide your symptoms from me?
You're not my real dad.
Why would you say that?
I know you coughed up blood earlier. It's on your clothing.
Oh. It's just some blood.
It's
I'm
just
full
some
of the
blood.
stuff.
I'm full of the
Blood.
stuff. I got loads of this stuff. I don't need it. I don't need that blood.
Seriously, who do you inherit this attitude from? Well, we're done talking. I need you to undergo a few tests for me. Roni, get approval for an x-ray.
Yes, doctor. The X-ray examination is now available.
That's funny. I'm full of the stuff. I love that line. That is a great line. I'm full of the stuff. I'm full of blood.
All right.
I don't need that blood. Okay. X-ray scan with a contrast medium. Shows the patient's stomach. I know what a stomach looks like, Roni. Thank you. Just shut it and let me see. Honestly, at first I thought that thing on the left was a face. It was kind of creepy looking. Nothing looks abnormal that I can tell about it. Alright, image number 2. There's a speck here. Or a speck missing here. Not there. Let me try to get a little more accurate. There we go.
There's a cave-in in the gastric wall. The contrast medium is settled in it. Well, this is definitely proof. You can't make excuses anymore.
I agree, doctor. New symptom observed. Caved-in gastric wall.
I think I had something similar happen. I mean, not like this coughing up blood and everything this kid's got going on, but I think I went through a similar procedure once. I remember they had me drink some sort of liquid that would make a contrast on an X-ray, because I think they wanted to check my esophagus or something. I remember them doing something like that. That's cool. I mean, not for this kid. That's probably bad to have a caved-in gastric wall. Everything else looks similar, though. What else can we pull out of here? It looks pretty much the same as far as I can tell for that one. That looks similar too. That can't be it, right? Is that it? Ooh, that's a good idea. Alright, let's go talk to him. Maybe that was it. Hey kid, you're lying to me.
I have proof that there's something wrong with your stomach. You ready to talk now?
You ready to talk, kid? We'll get the stick out again. Ready to talk, kid? You ready to talk?
My tummy hurts once in a while, but that's it.
Hurt tummy, write it down exactly verbatim to that.
So he does have stomach aches. What an idiot. I bet they hurt a whole lot too. Well, Roni, he's finally coming clean with us. You writing all this down?
Yes, Doctor. New symptom observed. Stomachache.
Perfect.
Yeah, I don't feel like eating when it hurts. What's wrong with that?
That's another thing, right? That's, loss of appetite.
You don't feel like eating, huh? Well, given your stomach's condition, I'm not surprised. Roni, make a note.
Understood, Doctor. New symptom observed. Lack of appetite.
We're gonna figure it all out, kid. You might as well just give up now. Just tell us what your symptom is, stop trying to hide it. Or your whatever your condition
Everyone
is.
keeps making a fuss about it, but it's nothing. Really.
No, it's nothing.
Doctor, I'm okay.
Coughing up blood is perfectly
Seriously?
normal. You're full of the stuff.
All right.
Well, we got
Now,
two
is there
things at
anything
least.
else you're hiding? This is your chance.
I'm not hiding anything. I really am okay.
Look, you coughing blood?
Man,
Stupid kid.
Time to go back to the office and continue with the diagnosis.
Alright. Sounds about right.
Well, we have at least a few symptoms to work with, Roni. Let's start narrowing things down.
Understood, Doctor. Displaying diagnosis candidates.
Can we eat some chips? I'm hungry. Alright, let's... Malignant lung tumor? What does that have to do with your stomach? I would imagine it'd be more a malignant stomach tumor, if anything. But we'll go through it anyway. That one's... Hold on. Oop, darn. It's not A and B, it's just A. Let's see that at least. Coughing, was that no, that's shortness of breath. Why didn't we write coughing down as a symptom? Unless that's something that we were supposed to. Tumor shadows. I guess we never really looked at the lung. Sputum cytology. Yeah, I have a feeling this isn't it. This has to do with the lungs. Yeah. Stomach tumor, could be that. Okay, well there was, let's see. Increased heart rate. Hematemesis. That sounds like an evil bad guy, right? Hematemesis. Your worst nightmare. Tachypnea, yeah. Stomachache, loss of appetite, caved in gastric wall. We probably need to do a tissue test to find out for that one, right? Or maybe that isn't it. Oh man, look at this bacterial pulmonemia. Fever, I don't really know. We have coughing, pus-like sputum. Chest pain, dyspnea. That's this, right? Oh, apparently not. Oh, dyspnea, shortness of breath. Tachypnea, I think is rapid. There is, yeah. Increased heart rate. I didn't get that. I don't think it's that. I'm pretty sure it's a gastric ulcer. In fact, that actually is kind of what it sounds like. But we're gonna keep going down. We got rapid breathing. Hematemesis. I don't think it's this one either. I think it is an ulcer. Got increased heart rate, rapid breathing. Oh, and hematemesis. Sure, we'll grab that one first. Stomach ache, and loss of appetite. X-ray exam will show a caved-in gastric wall. Tissue test of the lesion site will result in no malignancy. So we have to do a tissue test then, right? Is that what it's saying? Oh, no, that's it? Oh, that's it. Okay, that's all we gotta do. You got an ulcer, kid.
Is it a
That wasn't
gastric
too
ulcer?
hard.
That's odd. Joshua already had endoscopic surgery recently. There's
Ah.
gotta be a reason for the relapse. Roni, let's continue with the diagnosis.
That was probably, he was probably in endoscopy treatment earlier, I bet.
Sending the request to continue diagnosis.
You already been fixed, kid. What's wrong with you?
Something's wrong. The ulcers have returned.
It's guilt, I know it.
I anticipate there is an
It's always
underlying
guilt.
disease,
Anything that's
Doctor.
weird is guilt.
Yeah, I just hope there's no other complications.
That would be very beneficial, Doctor. Should we begin?
Mm-hmm. Let's do it.
Let's.
You're having a relapse of gastric ulcers, which I'm guessing hurts. A lot. Why do you keep trying to hide your symptoms from me?
You can't tell me what to do, Dad.
There's nothing wrong with me. I really didn't notice it.
Just stop it. There's no way you're all right. Now listen to me. I don't know why you're pretending to be fine, and I don't care why. But the more you keep this up, the more you make everyone around you worry about you.
Uh-oh.
But
Whoa, there's no need to explain. If you don't want to talk about it, then that's fine. I've gotten permission from Lisa, I mean your mother, already. Roni, get the examinations ready.
Good
If he's
slip
not
up
going
there.
to talk, then I'll find out myself.
Understood. Doctor, please calm down.
Doctor, put away the stick. We can't afford the stick anymore.
Oh, sorry.
He's gonna start coughing up more blood. We're gonna get in trouble here.
X-ray, CT, and analysis exams are now available.
Okay, so let's start over again. You gonna talk, kid? Oh wait, no. This is diagnostic. Never mind. Let's see. Looks okay. I always miss something in here, don't I? Like, I always have to come back in here and look at something again. Unless, of course, they're messing with my mind and they actually change something mid-mission. That's an idea. Though I doubt it, I probably just miss a number somewhere in there. Everything looks good so far. I already checked that one. Didn't see that one. Yeah, that one's good. Oh, your serum amylase is way too high.
Serum
It
amylase
seems unusually high.
Roni, add that to our list.
Understood, Doctor. New symptom observed. High serum amylase level.
Oh, and his serum lipase seems to be high as well.
His serum lipase level is a bit higher than I'd like it to
Lipase,
be.
that's what I meant. I'm a doctor, I know.
Roni, record that.
Understood, Doctor. New symptom observed. High serum lipase level.
We figured you out, kid. Why didn't you tell me about your serum amylase and serum lipase level being too high? What are you hiding here? And your acetase level, everyone knows what an acetase level is.
His elastase level is elevated.
The last days.
Roni, you got
You
that?
dang kid, stop hiding your weird
Understood,
word
Doctor.
name things
New
from us.
symptom observed. High elastase level.
We're gonna find out if you have any more levels that are high, kid. Yes, all those look good. Yeah, everything else is within normal levels. We're finding it out. My blood seemed to have gone away. What is he hiding? Has he got blood cleaner? He does. He's hiding it. He's trying to clean it up.
Doctor, the X-ray and CT results are ready for you.
Let's take a look at him.
Okay, we got one X-ray. This looks like just kind of his general body area. Oh, hey-oh. There's a darkened area over here with the patient. I think in his... That's either stomach or lung, though. Just judging from my own body, that looks to be about lung level there.
There's an abnormal break in the bowel gas.
Ah ha ha, you got bowel gas.
Roni, record that.
Understood, Doctor. New symptom observed. Abnormal bowel gas in intestine.
Oh, is that not the chest area? Maybe that is near the bowels. Okay. Maybe it's a lot more zoomed in than I thought. I thought that was his waistline and this was gonna be his stomach area, that would be his chest area, but apparently not. CT, I always have the worst trouble with these. Let's check it out. So, I'm fairly certain this is his stomach, yet again. And a cursory glance seems to suggest that he's okay in this area. I think so, yeah. Let's check this area out. Seems alright. Oh wait, hold on. Whatever the heck this thing is bigger. Your thing's bigger.
Well, this isn't normal.
Your pancreas is swollen.
This is swollen. Roni, make a note of it.
Understood, Doctor. New symptom observed. Swollen pancreas.
That's what you get.
We've got a lot more to go off of now.
Doctor, we need the patient's cooperation for any further examination.
Oh, I know how to make him cooperate.
I should try talking to him again.
Do we not need to look at the last two CTs? I just thought about that. I don't think we do, but let me just take a quick look. See what they look like. Yeah, cursory glance seems to tell me that that's all fine. And that looks alright as well. Oh well, if the game tells me we're done, we'll go talk to the kid.
Well, I may have been a bit harsh earlier. I wasn't being professional. But you also...
Doctor,
I know. Just be quiet. Anyways, I want to cure you completely. And everyone is worried about you. Joshua, will you please cooperate with the exams?
Sorry.
Huh?
I'm sorry. I'm sorry.
Hey. Hey.
Now
It's
you made him
all right.
cry. Good job, Gabe.
Don't cry.
But it's all my fault. I didn't want my mom or that nurse to worry about me.
Joshua.
I'm really sorry. I just made everyone worry even more. I won't hide anything anymore. I want to get out of this hospital. So, please.
Yeah, I understand.
Thank you, kid.
Actually, my tummy feels a little weird. Can you check it out, Doctor?
Of course. Leave it to me. Roni, are you ready?
Yes, Doctor. I am fully prepared.
Wait, Doctor, I'm almost done with my card
All
game.
right, let's continue the exam.